So what we said yesterday was that, for example, let's say heart rate is up or heart rate is down. When it's down, you're talking about bradycardia. When it's high, you're talking about tachycardia. Okay, so, and then when minute ventilation is up, you call it hyperventilation. When it's low, you're talking about hypoventilation. Okay, when the blood pressure is up, you're talking about hypertension. When it's low, is hypotension. All right, okay. When respiratory rate is down, is bradypnea, right? When it's high, is tachypnea. When white blood cell is down, what do you call it? Leukopenia. When it is high, what do you call it? Leukocytosis, right? When red blood cell is down, automatically hematocrit is going to be down. What do you call that? Someone has low blood, what do you call it? Anemia. Very good. And when it is up, what do you call it? Polycythemia, right? Does that make sense? And we're not even done, because that's just the beginning of what we're going to say. What we're going to say is that now, you need to do something about it. It's your job to do something about this. For example, in the case of a hypotension, what are you going to do first? The very first thing before you leave the room, you came to the bedside, and you realized, oh, blood pressure is low. What are you going to do for that patient? First, what you want to do is you want to lower the head of a bed. You want to lower the head of a bed first. Feet up, head down with hypotension. What else you want to do? You want to give a medication. And you want to know what medication you want to give in order to elevate the blood pressure. So that's the first thing you will do. The very first thing you want to check, lower the head of the bed. Medication is something that you want to do. On the other hand, when patient has hypertension, what are you going to do? You want to give a medication, so you want to know the medications. What are the medications that you would suggest, such as atenolol? Atenolol is the medication you would give for hypertension. Now, what about if minute ventilation is low? What do you think is a possibility? What has happened? Why someone would be hypoventilating? Hypercapnic, okay. Usually we might get it for Friday, Saturday night coming to the hospital that they get something like what? Alcohol does lower the respiratory center. What about drug overdose? That's another one that causes low ventilation, and it's not good. With increased ventilation, which we call hyperventilation, it means that automatically something else goes up with it too, which is work of breathing. So what are you going to do for someone with the work of breathing? What's the first thing you would do? You're going to give them O2 therapy. Excellent. What else are you going to do? Okay.
Oh, bronchodilator.
You want to give them bronchodilator. You want to find out. You want to do assessment. All these things that you're going to do is part of the assessment. What your job with these two is to lower the work of breathing. That's what you're doing basically. With heart rate is low. 60 to 100 is normal. Below that is not normal. What are you going to do with the bradycardia? You want to give atropine. Very good. So be sure to know your medications. And if you don't know, you're going to go back and review. Very good. With tachycardia, what do you think is going on? There are multiple factors could be involved with tachycardia. And tachycardia is not good because it puts a stress on the heart. So what you want to do with tachycardia is this. For tachycardia, you want to look at the situation, so what it is, so you can fix it. The situation that we are dealing with a lot as a respiratory care practitioner, you will be dealing a lot with, number one is going to be hypoxemia. Number two, and well, these are not exactly by the number reference, but hypoxemia is something that we deal with a lot. And then you're going to get fever. And then you might get anxiety. With hypoxemia, what are you going to do? O2 therapy, very good. With fever, what are you going to do? Medication such as anti-infection medication. Anxiety, what are you going to do? Another med such as Xanax or anything else that is lowering the anxiety, that's what you want to do. Okay, now with the respiratory rate is bradypnea. What's going on here? This one is very similar to what we have for hypoventilation with bradypnea. So one of them could be the respiratory center. We're talking about nervous system. We talked about it today. Earlier we talked about that. We're talking about apneustic center. It could be pneumotaxic center. Any of these centers could be damaged. Central chemoreceptors could be damaged. And as a result, these patients are having problem with their breathing. So bradypnea, we're talking about the rate. Now, what about if someone has tachypnea? When someone has tachypnea, automatically we're talking about increased work of breathing. And what you want to do, you want to do the same thing you did under hyperventilation. You want to reverse. Your job and my job all day is to lower work of breathing. You want to help the patient, because if a patient is breathing, this is not normal. And if they do, your job, my job is to help them out by lowering the work of breathing. Leukopenia, if it is low, we are concerned. Leukopenia, white blood cell, you want to look at white blood cell as soldiers. They are defending the body. If we don't have enough soldiers, the possibility that we get attacked by external organism is high. So we want to do something about it. We want to watch out. We want to find out why we have low white blood cell to begin with. We want to find out why, because the reason of the why will lead us to fix it. Because this is not the primary, most likely this is secondary. So we need to find out what's the primary. In that case, someone who has low white blood cell, the possibility could be what? Like what? Exactly. So I'm going to put HIV. So what we want to do is we want to monitor these guys, these individuals, these patients, so they are not getting any source of infection. Because if they do, such as opportunistic pneumonia, if they do get it, it's going to be extremely difficult. They might lose their life, and it's going to be very difficult to manage such individuals. So we want to keep an eye on these guys. Leukocytosis, when we have increased white blood cell, what's going on. We have some sort of infection. So it comes with fever, perhaps. It comes with infection. Yes, pneumonia, PNA. That's our abbreviation for pneumonia. So what you want to do is you want to give some sort of a medication again. And then for low red blood cell, hematocrit, we're going to talk about anemia. For anemia, what are you going to do? You want to give them transfusion. You want to give them, what you said, iron? Okay, very good. You want to give them fluid. Very good. These are the pieces you got to put together at this point, because the question will not be giving me numbers anymore. The question will be how to fix it, what to do with it. The numbers only and only will be there in order for you to understand. For example, it's going to be 9 a.m. versus 9 p.m. What you're going to do is going to be something different. And what you're going to do is this. You're going to look at the number and you're going to modify your approach and function. For example, if it's 9 a.m., you go to work. If it is 9 p.m., you go to bed. That's what it is about the number. You're not going to treat the numbers, you're going to treat the patient, but the numbers are there as a reference for you, so you would know what exactly to do. So in the case of a polycythemia, what do you think? What kind of a patient population would have polycythemia most likely? COPD, yes. Patients, or not patients, rather, individuals who go to or live in high altitude, because they do develop polycythemia. So these are little ideas. We're going to talk even more about these normal values. That's why normal values are so important, because normal values are giving us a normal foundation or main foundation, or a pillar that we can build upon our understanding of what is going on inside the body. We need to have some core understanding. That's where it comes from. Any question? No, we're good? Yes. Everything. Everything.